Today, we were talking about health technology policy and legislation in developing countries. This is a team work with myself, Antonio Hernandez, former senior advisor on health technology for the Pan American Health Organization, World Health Organization, and Mario Castaneda, president of ICEHTMC and former CAICET permanent national leader of clinical technology. The scope of the presentation will highlight why it's important and necessary for engineers, technology managers, and engineering societies to be active involved in health technology policy and legislation during the process and the activities. And this, in fact, applies to not only developing countries, but developed ones. We will see some advanced limitations, opportunities, and leadership, the current status in developing countries, and what is expected as outcomes and benefits for the population at large, and also the sustainability of these programs and activities. And if we have time, we will give some examples of opportunities right now. Developing countries face strong challenges in the field of technology. And those are more evident due to the fast development of products, short lifespan of many products, the convergence of information technologies and communications with the health technologies, and the resources needed for management and operation of all these infrastructure and resources. For the past decades, several countries in the developing world have initiated programs to overcome these issues. In doing this, the main areas of development has been the initiation of programs of health technology assessment, the strengthening of the regulatory capacity for medical products, and the implementation of health technology management programs. All these areas of development has been enriched with an active participation of clinical and biomedical engineers. Currently, countries have advanced legislation in these areas. However, they have not allocated necessary resources to implementing all this legislation. And some of the limitations faced by the countries are due to the dependency on imported technology. Those are technology-dependent countries, and it's accompanied by the lack of expertise locally for management and maintain these technologies, and also was mentioned the limited budgets allocated to run the programs. International organizations, as the World Health Organization, the International Federation, the American College of Clinical Engineering, and Global Clinical Engineering Alliance has been instrumental in supporting the work at the country level and worldwide. Locally, in the countries, several actors are coordinating in order to advance these programs, mostly from the Ministries of Health, the Ministries of Science and Technology, and other groups that represent healthcare institutions, healthcare organizations, and biomedical and clinical engineering societies. This has been difficult in the countries that has public health sector and private health sector because it has been no coordination so far. In this scenario, the academic sector lately has been actively involved and has been participated in this development. This is very important because it's a factor for the sustainability of all these programs. As a result of the work done with the World Health Organization at international level, governments had signed resolutions where they get the commitment to develop and strengthen health technologies. And these resolutions and mandates has been used locally in the countries to develop health technology. As I mentioned before, currently countries have legislation, however, they not necessarily allocate the needed resources to implement this legislation. The next step to advance is to work with other actors that are involved at large in the development of public policy and the entities that emit legislation. The end is to promote legislation and mandates in the health technology field that allows to allocate resources in the national budget. Outcomes and the work is done in order to fulfill the mandates in the constitution of the countries of protecting the population. In that area, all technologies used in the country need to be assessed. There is a need of regulation of medical products with enforced capacity and surveillance and the management of health technology and health facilities infrastructure. This is very clear and this should be included in public policy. That in order to provide health services with equity, same to all, with quality, something that really shined to the population and in a cost-effective way. And also the health system operation, a clear organizational framework with the levels of complexity and interaction in the reference and counter-reference among institutions, clear delimitation of duties and responsibilities, the financial support for all the operation, and accountability. The results that are expected, and in some cases we have it out there, is the active participation in the public policy decision-making process and forums, so they could be translated into legislation mandatory to the institution. Also to promote awareness and advocacy in health technology, mainly interacting not only with the health sector or within the health sector, but with the group of interest in specific health technology areas or disease. The promotion of national strategic alliance, public, private, with academic partnership, all involved in this field should work together. Also, the coordination and support of scientific and professional societies to validate the work that is done. Participation in joint work with international agencies such like World Health Organization or NGOs working in the technology field. Development of institutional capacity building on infrastructure and technology locally establishment of link of network of institutions and experts, and participation in global initiatives to bring the perspective of the profession. For that, there are currently areas like the decision of WHO through the World Health Organization, if they moving from ICD-10 International Classification of Disease from version 10 to 11, and the implication for the countries, and the work that is currently done in the nomenclature for medical devices that will be presented to the World Health Assembly. And finally, this is the map that present in detail an outlook of the work in the area of health technology policy and legislation that we are developing. Well, thank you very much.